I first became interested in chiropractic when I was 16 years old. I remember my mom going through a terrible time with her low back, and she was suffering for over a year. I remember her going from doctor to doctor and getting medications and shots in her back, but basically nothing really helped her. Her neighbor one day was talking with her and said, "Why don't you try my chiropractor?" And my mom was like at that time, "Well, you know what? I've tried everything else. I have nothing to lose. I'll go ahead and try." So she called, she made the appointment. I would just drive her and, sit and wait for her in the car, listen to the radio. So one day, I wanted to go out with my friends one night, and I went into her room and I asked her to borrow the car. To my surprise, my mom was on the floor doing exercises like low back stretches and stuff like that, and I was like, "Wow, Mom, your back is feeling better." And she said, "Yeah, it's much better." And I said, "Well, what medication is he giving you?" And she said, "He doesn't give me medication, he works on me with his hands." Thought that was really cool. I went out that night, I got to use the car, and then the following week came. I drove it to the chiropractor. We had like this little routine, sometimes we'd go out to breakfast and then we'd go to the chiropractor. And that day it was extremely hot, and I remember saying to myself, well, I know the waiting room is air conditioned, so I think I'm gonna go and wait in the waiting room today. 5 minutes later, the waiting room door opens and the doctor walks out. Now, I'm the only one in the waiting room at this time. He starts walking over to me and he said, introduced himself, and he said, "So your mom tells me you're interested in chiropractic." And I said to myself, "Thanks, Mom." So I'm totally put on the spot at this point. So what was I to say? So I said, "Yep, I'm interested in chiropractic." And he said, "Well, would you like to see what we do as chiropractors?" And I'm like, "Sure." There was a really cool magnetic board, and it had a spine on it. And each one of the vertebrae of the spine was magnetic, and it could move. And he proceeded to tell me about the spine, and he said, "Now, this is what's happening with your mom's back." So he moved one vertebrae in one direction, he moved the other vertebrae in a different direction, and he said, "Now, this is causing the nerve to become inflamed, and that's why she's getting leg pain." And then he told me a little bit about what he does. He said, "We do what's called a chiropractic adjustment." And then he said, would you like to experience an adjustment?" At that point I stopped and I said, "Well, there's nothing wrong with me. I don't really need an adjustment." And then he said, "Well, you don't have to have anything wrong with you to get an adjustment. You could do it for the health benefits." And he went on to explain some of the health benefits about a chiropractic adjustment. And then I remember laying down on the table, and he adjusted one area in my mid-back, and then he adjusted my neck. And then I got up off the table, and I felt so good, and that whole day I felt good. I can't really describe how it made me feel, but I just knew that I just had a better sense of well-being, if you will. That's basically what got me interested in chiropractic. And fast forward to the present moment, chiropractic is a major branch of healthcare in the United States. We're specialists in the neuromusculoskeletal field. Our primary method of treatment is the chiropractic adjustment. Now, the chiropractic adjustment is very unique to our profession. Chiropractors have thousands of hours in learning how to apply an adjustment to the spine. What the adjustment actually does, it will restore normal function to an abnormally functioning joint. And it doesn't have to be the spine. It can be the shoulder, the hip, the knee, any joint in the body. Chiropractors are well trained to help these problems. The thing I like most about chiropractic is there are so many ways that we can help people. We talked about the primary method of treatment, which is the adjustment. There are many ways to deliver that adjustment. The first technique that we utilize is a technique called diversified, and this is adjusting the spinal joint by hand. But some people, they might be a little apprehensive about the the cracking or the popping sound that an adjustment might make. There are other ways we can deliver an adjustment. So chiropractors are also trained in instrument adjusting. And there are two instruments that I actually use in the office here. The first instrument is called the activator. Now the activator has been around since the 60s. And there's a technique that goes along with utilizing this particular instrument. So the activator uses a series of leg checks and balances and isolation tests to pinpoint the area that needs to be adjusted. It's a very low force tool, it's comfortable, and it's efficient, and I've had a lot of very good results with the activator. Now there's another instrument that we use in the office, and this is called the Impulse IQ. Now the Impulse IQ is the highest level of technology we have as a profession today. The chiropractor will assess the area and find the problematic zone and will utilize the impulse, and the impulse will actually measure and assess the motion of the joint. The beauty about the impulse is that it reads the motion of the joint in real time. So what that means is every time it's delivering an adjustment, it's actually monitoring how well that joint is moving, and when it senses the joint movement is perfect, it will turn itself off. This is something that, again, there's no cracking, there's no popping, it's very comfortable, it's great for elderly people, it's great for children, and this is something that I really like to utilize. Now, there's another technique that I also use in the practice called flexion distraction. Flexion distraction is used for mostly lower back problems, disc bulges, spinal stenosis, sciatica, or radiculopathy down the leg, even advanced arthritic changes in the lower lumbar spine and discs. Flexion distraction works phenomenally. It's a very gentle tractioning procedure, so it's very comfortable and the results are pretty immediate. Usually a person will come in, and if they have pain going down their leg or they have back problem from a disc, when they get up off the table, the results are pretty near immediate, that they will show a good amount of relief after one treatment. I've been in practice for 25 years. When it comes to chiropractic problems, I pretty much have seen it all. You don't have to suffer with pain by yourself. So if you're having any type of spinal pain, back pain, neck pain, or even sciatica, please feel free and make the call today. I'm sure that I can help you.